Hi, everybody, and welcome to the November Ambassador Briefing. We're excited to have you all as we're getting close to wrapping up our first full year of these Ambassador Briefings. So as a reminder to everybody, this will be recorded and then later shared on YouTube so that if you have any questions or anything you have afterwards, you can ask those questions and know that they will not be shared on the video. And so starting off first will be my colleague, Carlos Aparicio, who will speak about our Kidney Action Week and try and get some input from all of you folks. And then I will talk about our State Ambassador Leaders program. So without further ado, I will kick it off to Carlos.
Thank you very much, Ben. Much appreciated. And thank you all for allowing me to come and talk to you today. Shout out to a couple of folks that I see on here that I worked with during Kidney Action Week. Ellerly, Francis, I'm trying to see who else is here. Nelchi, Kate, obviously, Ben, and I thought I saw Leanne. There's Leanne. I think I got everybody, but thank you guys very much. Oh, and Nicole, thank you guys very much for participating in Kidney Action Week and for all of you for allowing me to come here today just to do a quick chat. So last time I presented a little bit about some of what happened during Kidney Action Week. So I just want to remind everybody, we hosted it September 13th through the 17th. Based on our calculations and kind of review of the data, we had over 7,000 people join us during the course of the week for Kidney Action Week. What's even more exciting about it actually is that the YouTube playlist has over 35,000 views at this point. So obviously we're really happy about the content. I think I mentioned at the last meeting that overall the reviews for the content, the speakers, and the usability of the information provided was extremely high, well over 90% for most of it, with people rating an 8 out of 10 or higher. So really happy with the way the Kidney Action Week has grown. So really a huge thanks to everybody across the organization, to our patient ambassadors, to Kidney Nation, to everybody who really participated. To give you a quick reminder of some of the sessions that we had during the week, and I can go through this pretty quickly. We had a couple of Ask a Nephrologist Q&As where we had two of our partner nephrologists come in and speak a little bit about kidney health. We had one on kidney disease and mental health. We had rare diseases. We had our congressional briefing. We had a session on home dialysis. We had a session on kidney transplantation, the root causes, so hypertension, diabetes, and it's understanding the connection between those two and kidney disease, as well as having another session about clinical trial diversity and the importance of clinical trials as a whole. So I wanted to tell you that we're in the process of planning Kidney Action Week 2022. And one of the things that we're looking at, and just to give you guys a heads up and a sneak peek, we're looking to change that to June. And part of that is really kind of based off of the feedback that we received from patients, making sure that we are trying to put it at a time that that is most available to the kidney public. In addition to that, one of the things that we are looking to do for next year is ensuring that we have some sessions that are also in the evening time on the East Coast so that they're more readily available for people on the West Coast. So again, trying to just continue to continuously improve this program, to continuously offer new things, and honestly, sometimes being able to offer some repetitive ones. We were actually in a meeting earlier where we talked about how usually it takes about 10 times of saying the same thing before somebody's behavior changes. So we're making sure that we're doing all of that. And one of the things that we want to do, and this is where I want to tap your minds a little bit, is we'd like to ask questions of the kidney community about the types of sessions and the types of information that you would like or that you know people could use. So thus far, I think that there's a few sessions that we're going to continue to work on, and there were some subjects that we're going to continue to touch on, and that includes things like stage 3 kidney disease. It includes things like kidney disease and mental health. We want to continue to talking about dialysis options. We want to talk about kidney transplantation and other kidney replacement therapies. So we want to make sure that some of those are still viable options, as well as nutrition. But we want to hear from you. You guys are really and truly the experts in this realm. You guys really are the ones who know what is useful to you, what could be useful to people who are starting or are going through their kidney journey. And we really wanted to tap the minds of the experts. So I wanted to just take a few minutes here today and just, if you guys could just throw me any ideas that you have. I don't care what they are about. We will take all of it under consideration. We will evaluate whether we have the opportunity to be able to put it on. And even if we're not able to put it on for Kidney Action Week this year, we may be able to put it on for the one next year. Or it could also be an opportunity for us to do some specialized one-off webinars as we go through the week. So as we go, May, who is also joining me here as part of my team, she'll be kind of taking some notes. So I want to kind of turn it over to you guys. Are there any topics that you think would be useful to you as you move forward, or that you think would be useful to people as they're starting or moving through their kidney journey that you think we should talk about during Kidney Action Week?
So Carlos, in the comments, Jim Myers put preemptive kidney transplants.
Okay, thank you, Jim. Appreciate it.
This is Stephanie.
Thank you, Stephanie.
And hi. While I believe that focus on transplant and in-home therapy is important, as an inpatient patient, in-center patient, I feel that we're being ignored. Our needs are not being met. Your message is sent throughout the transplant and the home hemo community, but it's not reaching those patients in the center that need it most. Also, I feel that this is a big wish of mine for Medicare and whatever the standards are to be equal across the board throughout the United States. There's so much, I receive so many calls every day from people trying to enlist me into their program, and Medicare starts these programs, but they don't educate people ahead of time to understand what they are and to know what to look out for. They send you this 99-page booklet if one cares to read it and figure out all that stuff, but basically that's it.
So Stephanie, if I may, I think I heard two things. One is kind of like demystifying the Medicare and Medicaid process. Does that make sense?
Not only the process, but right now it's open enrollment. So on a daily basis, 99 different insurers, or it says scam likely, people call me to want to get me into their program. It's annoying, and I wouldn't know which program to choose based on whatever it is that they tell me. I've previously enrolled in one of these programs because I could have a family member as a home attendant. Next thing I know, they were charging me $50 that I never had to pay before. And I called them and I said, why should I pay you $50 for what my family will do for me for free? So that you can pay them, I could just, if I had to, give my family member $50. And that's just ridiculous. So I got out of that scam. But there are a lot of scams and things out there.
Stephanie, can I, and I really appreciate that feedback. Can we go back to one of your first points? In one of your first points, you talked about the in-center community. It's kind of curious if you could elaborate on the types of information that you think would be helpful for the in-center community.
Well, I happen to go to a clinic that offers home therapy and transplant. So I'm fortunate. But I have, as an advocate, visited other clinics that do not offer those options, and they are not readily told about this because if they choose a different option, they will lose that patient at that clinic. So the patient generally will will have to go to another clinic, and they don't inform patients that these options exist. I've also advocated a clinic where they offer home therapy and they don't reach out to the patient. And they didn't even know that the program was available at their center.
That's very good to know. Thank you. And thank you to everybody who's putting things in the chat. There's some really great recommendations coming out right there, and we're making sure that we jot all those down. If please speak up or raise your hand. Either
okay,
way.
well, yes, this is Della. I want to speak up.
Thank you, Della. Please.
Okay, I was just saying I have a couple issues. I'm gonna join on Stephanie on what she just said, but I want to start off first. I put a couple comments that's in there. How to deal with kidney rejection, because that's currently something that I'm personally going through as a newly transplanted patient, and the battle and the journey has been really draining. And so I think it's limited information, especially that's given not only at the beginning of orientation or even throughout the process as you are dealing with like kidney rejection. So I think it's relative and important to talk about the signs, what some of the things you can do, how to deal with it mentally, dealing with depression and kidney rejection, something along that particular line. Because I'm telling you, as a transplant patient, I only had my kidney since 2019. This is now 2021, just 2 years, and I'm on this journey and battling. I know some people had it shorter than that, but it was no information really given or provided on this spectrum, how to deal with those emotions and how to deal with things that's happening as a transplant patient. So pre-transplant, post-transplant is two different, and it's so much emphasis sold on transplantation to the point that they don't speak about, that one is not a cure, it's a treatment, and how you're going to deal with that treatment, even when you are following the process. Now your situation is changing. That's number one. Number two, we were talking about Medicare. I just did a workshop seminar on Sunday at my church on the relations of Medicare. I brought in a professional to talk about the Medicare. And one of the things I learned that is not really something maybe somebody else know, but I learned was one about custodial care, that Medicare don't pick it up. We have to have these other supplemental insurance outside of the one we try to cover with the 20%. And if you have pre-existing condition, more than likely you're not going to be able to really qualify for what they are on their barometers and their measures. Long-term care is something, because the person who was sharing, her father wind up having issues to the point that he passed away. And the long-term care services and all of that happened for him, it fell right onto, it became a debt burden for the family, and it was over close to $60,000. So one of the things that she was talking about is trying to see and qualify to get those types of insurance, and that information is not really readily available. Even we talked about the Advantage plans, and I know a lot of, they sell it at, you get your dental, your eye, and everything, but one of the things they're not saying is certain processes and certain doctors is not part of the plan, certain things that what you thought that would be available, like some of my transplant medicines, even though you would think it'd be part of the plans here in Illinois, a few of them didn't pick it up, and the cost was crazy. So, of course, I've had people to say I had to dump Advantage to go back to the original Medicare just so they could be able to get the care. So that's just 3. I could go on, but I'm gonna stop at 3 because I got a few more things that I can really say, but I'm gonna stop right there.
Dal, I thank you very much. To be honest, I'm gonna, if other folks are jumping in, I am going to encourage you to keep going, because these are all really great. And folks, please do not stop yourself if you have any suggestions. Right now, we really are in a discovery phase, and anything you provide, not only helps us this time for 2022's Kidney Action Week, but it can help us with 2023, and it can help us with other of these types of webinars that we can provide to the public through our various options.
I agree.
I'll say also to everybody, if you have any ideas or any topics come to you once we're done with this, please feel free to email myself or Carlos. For all of you on here, I'm available pretty much 24/7 on my cell phone. So you can text me, you can email, but we would love to get the feedback from you whenever you all have it.
Yeah.
I have one more thing to add. I'm sorry, Della.
Go
I
ahead,
agree
Stephanie.
100% with you. But with regard to the insurance and the 20%, within New York, I can use my insurance. When I go outside of New York to travel to any other state, I have to pay. And that could be $200-300 that has to come out of my pocket. So what we really need is universal health care within the United States of America.
Ditto, ditto, ditto.
So Stephanie, what I'm hearing a little bit is, do you think it would help do like an advocacy training during Kidney Action Week, or like something of that sort to kind of get everybody on the like geared up? I know that our Office of Government Affairs does an incredible job in kind of working with the Ambassador Network, but I'm wondering if that would be something of an option.
It would be helpful, but there are 12 states in the United States that have different Medicaid, Medicare programs. So when we travel, it costs us money. And I know it's a difficult ask, but we need all of them to get on board with what we're asking for and what we need.
Okay. So we'll definitely jot that down and see if there's something we can figure out to kind of work within that context, because I think that is a very good point. I don't think I'd ever thought about the impacts of people traveling to different states and how it when you're trying to work through these insurance plans.
It is important because
not just for vacation. I'm sorry, Della. Not just for vacation, but when I go to do any other event, whether it's your event or a technical expert panel or whatever, I have to pay out of pocket in order to be a part of that.
Okay, thank you. So we have another one. So we have quite a bit on insurance. I see one on palliative care, transplant list 101, the role of the transplant team. That's a good one.
Actually, just even the from start to finish, because I happened to go back and find my transplant book, and from the hospital where I received my transplant from, and I really picked it through. I'm an educator, so I really fine-tuned it, and it was just really missing a lot of the things that now, after being transplanted, that I'm experiencing. I'm talking from the longevity of the kidney, the measure of, like what is their life expectancy, or what's that particular number? I can't think of the, COVID fog, just blame, I just got to blame it on that. But it's a word that I'm looking for, and it's stuck in my head, but it won't come out. But the point of the measure of the longevity of that kidney, if this kidney, what would happen, by, giving me the choice, would I want to take a kidney whose the measures, I can't think of the word right now, if it's going to show, or maybe anybody on here know what I'm talking about, please speak up, because I can't think of the word that I'm looking for right now. It's burning me.
Suboptimal? Is that what you're saying?
Which what is it? What is it?
Are you talking about a suboptimal kidney?
That's not the word that was there, but it might, if you explain that, maybe it'll what you mean by that, maybe I can say it is that.
Suboptimal kidneys are ones that could possibly have greater risk, like usually comes from a deceased donor, and they might have been intravenous drug use or things like that, where it's not as great of a kidney, but they're still willing to give people a chance, but they just let them know up front that it might not have as high of a chance of success.
Okay,
well, they
not
give
that.
it to a senior citizen.
What'd you just say, Steph?
They might give it to a senior citizen, someone whose lifespan is expected to be less. They wouldn't give it, per se, to an 18-year-old, but they might give it to a 75 or 80-year-old.
Yeah. Both of you guys, I remember that now, Ben, once you shared that, but that was not my kidney. It was a little bit different in this case. But then when they shared with me about what I want to take it, they automatically told me, you know, supposedly that this kidney expectancy is supposed to be 4 years. But in my particular case, as you see here, I'm already starting the phases of kidney rejection, so 4 years is not. I think what I'm looking for is something to really explain that when they give you that life expectancy of the kidney, that's not the period at the end of the sentence. You need something to say that this is the anticipated, but not the exact. Because when you have it in your mindset that, oh, I got 4 years or something along that particular line, that's a false reality. Because now my head is on, okay, I'm back into, you know, if this doesn't work out, the process that we're going through, I'm back on dialysis. So now what do I need to do? Do I go back in center for a little while? My house that I just bought technically is not really set up to do home therapy. That's extra cost. All of these things that is going through my head right now. So I think that false sense of reality was given unto me from orientation, evaluation, because nobody really truly gave a good evaluation, all the way to waiting list, in which in my case, because I did 11 years of dialysis, my wait list time was shorter, and then transplantation. So I think we need to talk about the referral, the evaluation, and go on that, just so that we will understand those processes and not come up with a false sense of reality of transplantation.
Thank you, Della.
Della,
Yes, ma'am.
you need to ask questions. When they call you in for a kidney, it sounds like they offered you a suboptimal kidney, and they said it would last maximum 4 years. You could ask. You could deny the kidney and say, I'll wait for something that's going to last for 20 years. And you should ask the question, why is it that this particular kidney is only expected to last for 4 years when I have friends who've had kidneys for 20?
You know what?
And they should give you some kind of explanation. And then say, no, thank you.
What you're saying, Stephanie, is good and it's true, but you got to look at it from this lens also. You know, when I got the call, all I heard after 11 years, all I heard is that I qualified finally for a kidney. My questions came afterwards, not so much more so before, but at the same time, what was in my head is, do I want to continue sitting in this chair, or do I want to have a chance to whatever time I have just to be able just to live the best normal life that I can? So when you're dealing with that emotions and everything at that time, you're going to choose the one that's going to be what you believe is the best option. But yet still, I do believe and feel that from, again, evaluation to wait listing, and that wasn't my case as far as like I hear some other people's have went through, but there's still, that is something I think a stronger emphasis needs to be made when you're going through that process. And I'm going to shut up and let somebody else talk.
Well, thank you both. To be honest, I really appreciate it. I think there's a lot of the information that you're providing is really excellent. I think we're hearing about insurance, we're hearing about post-transplant support, we're hearing about in-center and home dialysis education and information. We're hearing about medication management. We are hearing about mental health, pre-transplant and post. Trying to see the role of the dialysis team, palliative care, again, a transplant 101. So please keep these flowing. I think these are really great topics and really great information. Well, I'll say one other thing, just if for many of you think back to when you first started kind of your kidney journey, and what were the types of things that you wish you had known that may be helpful for people?
Hi, so I've had my kidney transplant for 25 years now, and I was only 12 years old when I first got it. But I think something that is really needed is just like she was just explaining, I think more information on what to expect. Primarily, I think what to expect from the medications and the side effects of it, and what, you know, other things that cause those medications, like, you know, the mental health, depression, or just basically the side effects and how to deal with them. Just more support.
Okay, thank you. So I want to keep this going, but I also want to mention that I'm more than happy, like, if you guys think of stuff outside of this. I know I appreciate Ben's kind of openness to creating an open forum, so I'm more than happy to come back at a later time if you guys come up with other ideas. Don't be surprised if you see me again. But again, just please keep it going if there's anything else you guys want us to consider for kidney action. Anything on medications or anything? I'm trying to think what else has come up. Nutrition has obviously come up quite a few times. Are there any questions you would like to ask, for example, of your nephrologist, of your kidney care team?
It's Lori. Can you hear me?
Yes. Hi, Lori.
Oh, hi. It's hard because I'm, you're gonna have to stare at my dog because I'm cleaning the house. I don't want to be seen on camera, but as someone who's lived with a transplant for 25 years and was a transplant coordinator for 15 years, hearing all these concerns, I'm just dying to like spill out everything. But I did suggest maybe a transplant panel discussion, something as a separate workshop. As far as, I also mentioned an idea about empowering people to speak up to their healthcare providers, ask the questions, get yourself educated. I honestly was on hemo for a year and a half, had no clue how the machine worked. And I'm a nurse, I had no clue. And nor did anyone want to explain it to me. All I knew was how much time I had left and what my blood pressure was, which were my two focuses anyway. So I kind of wish that the dialysis folks had explained a lot more to me. I was a month in the hospital, so for them to hand me a book of 600 pages to sign as an intro to my dialysis unit experience, and they didn't bother to tell me to bring a blanket. I think to this day, it was the worst day of my life, was my first day at a hemodialysis center because it was 65 degrees in the room. And so it's little stuff like that, but I like the idea of just like asking the questions, things I wish my doctor had told me, or things I wish my transplant team had told me, things I wish my dialysis unit person had told me. I didn't even get to meet the social worker the first time. So, and maybe that was just my unit and I had a bad experience, but I like the idea of a transplant 101, but there's how the kidney is put in. There's that surgical part, which most people kind of understand. And they usually get an evaluation, with a class. UNOS does mandate certain information be given to patients. It's a UNOS mandate. You all sign a letter and you get this little copy of the thing that you've been educated on. That doesn't mean you remember it when you're on a list for years. I get that. Some centers are too big to call everybody in every year to reiterate the education. We were lucky enough to be a small center, and I was able to call the patients and reiterate the education. But I really appreciate the feedback I'm hearing. Having, I feel bad that some of you are feeling like the transplant team didn't share with you enough information. So yeah, I really think a transplant sort of workshop would be great. I don't know if it should be part of Kidney Week or separate, but I think it would be a great idea.
Great, thank you, Lori. And I see custodial care and I see caregivers in the chat. We'll make sure that we jot that down. Any thoughts on talking about, you guys mentioned talking to your medical team, you've mentioned talking to your care team. Just kind of curious if there's anything around like the diagnosis for kidney disease or anything about when people are diagnosed, understanding the testing, anything like that that you think would be helpful or would have been helpful?
All of the above.
Yeah,
Okay.
I agree.
I mean, my particular case, I didn't know anything about dialysis. I didn't know what it was. I was told You need it, and if you don't get it, you're going to die. All I heard was, I'm dying. So, and then
And
I was
from,
fortunate enough to land in a clinic where they educated me. And in addition to what the previous caller said, you also need to know, if you're in center, how to get off of the machine in an emergency.
this is Lori. As a transplant coordinator, I was a pre-transplant coordinator, so I met all of the patients coming in wanting to be on the list. And I live out in the Inland Empire of Southern California. So the majority of my patients were Latino. And I can tell you 8 out of 10 couldn't tell me why their kidneys failed. None of them knew why. It really bothered me. The language disparity caused a lot of misinformation. Frankly, not a lot of education given. Nobody was willing to take the time to use a translator. So yeah, I like that. To me, when you ask about what they wish they had known and things like that, most of them didn't even know how they got their kidney failure. They were sitting there as diabetics for 15 years, but didn't tie, no one connected the dots for them. So yeah, I think that would be a great topic, as well as, not what causes kidney failure. That's kind of the big part of Kidney Week, but to ask the question, why am I in kidney failure, would be nice to know. I'm surprised how many of my patients didn't know that.
So can I ask a question? So thank you for saying that. It's a very, it's a topic that we're definitely trying to address with some of our work on health equity and health disparity. So I think is incredibly timely. 2 questions that I wanted to ask, just kind of related to all of this, is what do you think is the best way for you to receive information? And what I mean by that, do you prefer hour-long webinars? Do you prefer shorter ones? Do you prefer print materials? Do you prefer PDFs, emails? What really is, if from your perspective, the best way for us to provide you the information in a way that you can, that's convenient and that you're able to kind of absorb?
I prefer shorter webinars, because if you're going to go from 9 to 5, you lose people.
So shorter, okay.
I'm sorry I'm late. This is David Rodriguez. I'm sorry I'm late. I just finished doing. I'm part of the with Sanofi with Kidney Connectors, and it's a program that does webs, and I do Spanish. Me and my partner, and so we just finished an hour, and it deals with hospitals, and so we translate in Spanish every single detail, what comes from being on transplant, being on a list, to what the process is. Of course, we're not medical experts, so we have medical experts for that in our panel. And so we do that. I just finished doing one right now, and an hour goes by really fast, but it's very, if you put it together, it's very educative for people. Like I said, my name is David Rodriguez. I live in Texas and south of the border, so I'm very familiar as far as people that, Hispanic in our culture. Like the young lady was saying back in California, sure, sometimes they don't know, but they don't realize that diabetes leads to kidney failure and high blood pressure. And that's how I got my kidney failure, through high blood pressure. And so, yeah, it's good to be educated as far as what leads to educate on preemptive to avoid diabetes and high blood pressure, and also to how it is that leads it. Like for me personally, I tell my family that dialysis doesn't run in our family. What runs in our family is diabetes and high blood pressure. So we all need to be careful, especially if it's genetic. So that's the idea that we give out here in South Texas. And so I just wanted to give you a small feedback myself.
David, thank you very much. Can I ask a general question kind of related to what you just talked about? And this is kind of out to the group. Family members. I mean, we talked about caregivers and the important role that they play. Any thoughts on you, David? You're talking about genetic components. You're talking about family, kind of the family factors that are involved. Do you guys think that anything like that should be a topic that we talk about Kidney Action Week? But more than that, any thoughts on ways that we could impact that from the prevention side?
As far as what, sir?
So obviously one of the big pieces from the American Kidney Fund is we're trying to kind of raise awareness. We're trying to really kind of push prevention because, prevention is really one of the significant aspects of this disease. So just kind of curious if you guys had any feedback or if you guys could provide us any advice on like avenues that we could utilize to really kind of help with that prevention and messaging, whether it's family connections or like any other kinds of opportunities that exist.
Well, it's
I
really
would say
difficult to be honest
connect
with
with
you.
your local, I'm sorry.
No, go ahead, ma'am.
I would suggest dealing with your ESRD network, which is in all of the states of the United States and the property, because they can reach the patient. You have to be able to reach the patient.
Thank you, Stephanie. David?
Well, I just want to say in my previous employer, I used to work for University Transplant Center as a patient relations specialist. And throughout the years that I've done, I used to go to dialysis units. And here, like I said, in South Texas, very big Texas and Middle Texas, that's why I represent with you guys. And I'm so fortunate to be, I'm so glad to be a member, is that I visit over 200 dialysis units per year. And I do conduct lobby days and provide information what we can to, but you have to understand, like in our Hispanic, maybe adults, maybe they could relate. I don't think it's a ethnicity part, but I think many adults are very reserved about approaching information. And a lot of times that when we provide information, they're listening, but it's really hard for them to come forward and to really ask a question. And I remember that everyone to leave the room, they're the last ones to be there because they want to approach as an individual, they want to approach as a crowd. So it varies from a lot of people that I experienced in my 10 years as far as being an advocate throughout Texas and visiting all these dialysis units.
Thank you. Sorry.
This is Lori. On the caregiver issue, most transplant centers, I would think, I know it was mandatory, it was part of the selection criteria. You had to have a caregiver for after transplant, but we also insisted they bring a caregiver to the evaluation so they also could hear all the education we provided to the patients. Because, and I'm not saying patients don't hear it all, but it is always better to have more ears listening and eyes looking at the information than just yourself when you're going through a lot. So we insisted on it. That was mandatory. We did not list patients who did not have proof of some sort of caregiver to help them, at least in the initial part of transportation, making sure the medications are being taken correctly and all of that. And I actually didn't have a caregiver go to my transplant evaluation. I guess they just trusted me because I worked in transplant. I knew I could get through it. But, that's critical. I think I'm worried about how many people don't have or are unwilling to ask someone to help them out through the dialysis and the transplant process. That's a good topic to have.
Yeah, Lori has a good point because, a lot of times they require a caregiver. A lot of times people are afraid to ask a loved one, but a lot of times people are married, they have couples and so forth. And I think during the time of the transplant educational, because of course they have to have a caregiver to be there for the first 6 weeks after post-transplant. And so that's very, very critical to have a caregiver. And not only that, sometimes, when they go through the education process, they hit two birds with one stone because the caregiver also gets educated as far as being how to be a living donor, and not only that, how to be a champion for their loved one. So you kind of hit two birds with one stone with that. So they get to educate themselves about their husband or wife, but also at the same time educate themselves about promoting living donation and how to become their champion as well.
Thank you. Good advice, Stella.
Yes, thank you. I want to share about that. My daughter attended my session with me. And of course, I was asking the relative questions that I had at that time. But I found that afterwards, I had to go through a training session for her because she was so inquisitive about everything. So, because she came in with that limited knowledge and understanding of what was going forth and actually the terminology that was being used. So I wind up having to share it from a patient perspective to give her an idea about what my care would be, what my care needs to look like. post-transplant so they can, both her and my youngest daughter can assist me. But what happens is when you trying to explain it to your loved one, because you trying to get it yourself, and then you find yourself having to train it to share it with her or with them, that causes a little bit extra strain. And then at the same time, that limited information that shares something to me is that throughout this whole journey in my process, me being single, she was only going to be able to provide that limited amount of support because she was trying to learn truly about the kidney disease itself and how much it affected me, because my kidneys failed because of lupus, not because of specifically high blood pressure, which added on some other additional issues. So both her and my youngest daughter, even though I was staying with them post-transplant, I still felt that I was by myself, even though I was living with one of them, because reality, they had life. So they would leave, still work, go to work, where I was at home trying to prepare and take care of my dressings and everything. That's why they could not get away from their job, from their work. So the end result was I'm single, trying to handle post-transplant care, and it was limited. So it's wonderful to have that support, but if they don't understand that information from the beginning or whatever, it's going to be a challenge. And I'm still saying that maybe even evaluation, something, or maybe they need their own class during evaluation time, something, because I found myself being her instructor while I'm trying to take care of it and do for myself. So
Della, thank you very much. And thank you all. I know I'm down to about 30 seconds here, but I hope it'll be okay if I come back and or a member of our team comes back just to ask a few questions as we kind of go through this. I also want to just plant the idea of maybe having some listening sessions. This has been absolutely wonderful. We've loved not only the passion that you guys have demonstrated, but also the topics that you have provided. And again, I hope it's okay that we come back at a future time to ask for more of your input regarding the offerings that we can do. Thank you again, Ben. I know I'm way over my time, and
No, it's all right.
I'm really appreciative of all of the feedback, the information you guys have provided.
Thanks, Carlos. Yeah, and Carlos, you're definitely welcome back for any of these briefings. And I do hope for everyone who has been participating, if you have any other thoughts or anything else you want to share, like I said, later today, tomorrow, next week, whenever, please feel free to share with me or with Carlos. We'll make sure your thoughts are heard. And then quickly, I'll go through our brand new State Ambassador Leader Program. Let me see if I can do shared screen here. Here we go. Okay, so we talk about the State Ambassadors Leader Program. First is, hope everyone please sign up. Charles, I just checked while we were on this, I didn't have the application from you. So if you could just double check for the invite, or if you don't have that, you can just go to kidneyfund.org/state-leaders. It's a very easy application. And a big reason we're making everybody applying, even if I've known you since day one, is at AKF, we're consolidating all the stories we have from all the ambassadors, because truthfully, I probably know more about the ambassadors than anybody, but that's not necessarily the best way to operate an organization, because then everyone just has to go to me to find out info about the ambassadors, when we will have a central story database so that everyone can find out the things on their own. And also, lots of people work with different ambassadors that I might not have experience with. So we're going to have this central database. So that's why it's important to get everyone's info. And number two, obviously, this will be fun. I wouldn't ask you guys to do something if it wasn't. And everyone will get a cool thank you gift. As some people mentioned earlier, it is a very nice, thick blanket. I got it as a sample from the company. As soon as I got it, I texted Holly immediately. I was like, this is what we have to get for ambassadors. So number 2, we're going to try and do folks in all 50 states, but instead of a boring map, I found the most popular ice cream flavor if you take chocolate and vanilla out of the equation. Unfortunately, Maryland did cookie dough, which is not an ice cream flavor I would choose. There's Baskin Robbins by my house, and I never get cookie dough. But I was surprised to see brownie. Real strong in the mountain states, and then the Texas all the way east to Alabama. So we'll say, why did we start this program? It's formalized an unofficial list that we had. So I had a list of people who had done advocacy for us in the different states that I felt that we could ask again to do different advocacy work. That list was usually about 140 people, but it wasn't necessarily open to everyone. It was sort of limiting if I hadn't done stuff with folks. So as Della can tell you, if there was something in Illinois, Della got a call or a text from me immediately. In Texas, David Rodriguez would also always be contacted by me. And not that you two are off the hook by any means, but we just want to make sure that everyone is aware of the opportunities with engagement with advocacy and AKF. So that's why everyone is invited to apply for the State Ambassador Leader Program. And also, we would sort of want to give everyone sort of a blueprint or a ladder of engagement for what they can do. Because some folks have experience with different forms of advocacy, but it might not be as wide as some other folks. So we just want people to see all sort of the options that are out there. And we want to keep people engaged throughout the year so that people can see everything there. And to help, we're going to have a brand new advocacy toolkit in 2022. And so we're going to give everyone a checklist next year. We're still finalizing things, but the required advocacy activities, these are all really easy. Join the advocacy network, easy. Follow us on social media, join our Facebook group, and all these are conditioned on if you have social media. A big one here is contact your state and federal elected officials to get on their mailing lists. Because Bobby Reed is a great example. She sent me an email from her state senator about them having a senior fair, and they wanted some materials from us. So we FedExed over, I think, 500 copies of our leave behinds so that they could give them out to the folks that attended the senior fair, which is huge. So what we want is to find out about those opportunities, but it would take me way too long to get on every single senator, congressperson, and state elected officials mailing list. So that's why I need you folks to help out. And then if you see anything that we could possibly participate in, definitely feel free to let us know. And then the last required activity will be do the applicable AKF action alerts. Real easy. It's all things that you guys all support already. The optional ones, which is what we'll have to fit, is follow your elected officials on your social media accounts. This is optional because AKF does things very bipartisan. We do not care what someone's political party is. But as an ambassador volunteer, there is a chance you may not be a fan of your elected officials. So we're not going to require you to follow their social media accounts and see content you may not approve of. But we also ask that folks, if they have social media, share some of the posts that we do. We have lots of action alerts that we share and other good content. So I'm sure you can all find content you'd like to share. When we ask to send emails to, put that one in twice, so it's doubly important. Send email to your federal lawmakers on behalf of AKF legislative efforts. Second one was supposed to say, send email to state lawmakers on behalf of our legislative efforts. We've been doing in-district phone calls. I think almost all of you on this call have done one with me. If not, I'm more than happy to do one. To do conference calls with your elected officials. Through COVID, it's made local staff much more available to us, and we've been able to do a lot more meetings, so that's been good. When the opportunity arises to submit testimony for state legislation, and state houses are generally only in session the first few months of the year, so we might not have done much for the past 9 months, but it could really pick up in January. And want to mention that, our Kidney Action Summit, formerly called our Fly-In, we usually bring in about 30 folks. And unfortunately, we do get way over 100 applications, and everyone who applies is really solid, but we are just limited in the amount of folks that we can bring. But, if someone does attend, that will obviously count for that. And I got clearance from Holly to reveal when our Kidney Action Summit will be next year. So without further ado, it will be on May 4th, also known as National Star Wars Day. So I am very excited to, as much as I get approval from my vice president, incorporate Star Wars into Kidney Action Summit as much as we can. But in all seriousness, moving it into May does give us a lot more flexibility, and it will also take us out of the window of the state legislative efforts. So it'll be good to have those things done, because then that will also give us more things that we can talk about with the elected officials in Congress about, things that have done in the state, because, Living Donor Protection Act is one piece of legislation that we've really been pushing on the state level. And that's been working. And it helps when, when our Hill folks are talking to the Hill staff members and saying, well, you already have it on your state level. So it'd be great if you supported it as well.
Hey, Ben, real quick.
Yeah.
Next year in 2022, isn't the state officials, isn't it an election year or something like that? Or any effect of our policies and stuff?
So that's a good point, because it could make it difficult for us to accomplish things, but also possibly not. And so for most people in Congress, their primary is what is going to matter. And I think Maryland's primary is in June. So folks will be working towards that, but it could also be a benefit, because if people are working in Congress, they want to make sure that they are responding to their constituents and making sure that, especially when it's close to an election, that folks are doing their job. Of course, we would love members of Congress and state elected officials to be working as hard as possible every single day, regardless of when it's election. But reality is, things might pick up advocacy-wise because there's an election. So it could be good, could be bad. But I think we're positioned pretty well on May 4th for having the Kidney Action Summit then. So real quick, if you have any questions, please let me know. Once again, the link to apply is kidneyfund.org/state-leaders. And it's a very simple application. It's pretty much just getting your contact info, which is necessary, because once you become a state leader, I will be sending you those very nice comfy blankets. So we want to make sure it gets to the correct address. And then pretty much just want to get your story, because also, over the years, we've seen that some folks have changed their dialysis modality. Some folks have gotten transplants, and we might not necessarily be the first people you tell. So we just want to make sure that we have those current stories in our database. So that is it for the presentation. Does anybody have any questions? Is there anyone on? Go ahead. I heard somebody asking a question.
Sorry, this is Stephanie. No question. I just want to thank you for the swag box, but you should, I'm insensitive patient, and I could only distribute what I had in the box, and I got a lot of side eye from other people.
Well, Stephanie, let people know I can send you another box of things to share.
Thank you.
And so that is a good point. We trying to see who else here. Oh, Karen Solomon Edwards, you're getting a box as well. In the past, and Francis, you're getting a box as well. In the past on these Zoom briefings, I asked folks who are able to distribute some of our things to patients or kidney health coach sessions, things like that. So finally put together some boxes of our giveaways and some kidney health coach materials and other things in there that have been sent out. So if there's anyone else, Jim, you're getting a box as well. You raised your hand before. If there's anyone else here who either goes in center or has the capability to hand out some things to patients in your area, definitely feel free to let me know, and I can send a box of stuff over. And these are, just so the folks are aware, these are the things that we've given out to a lot of you over the years, the different giveaways with our name and logo on them. But if you have specific needs for educational materials and things like that, we are more than happy to put those things together. I just didn't want to include those things in people's boxes without anybody specifically requesting them. Didn't want to weigh anybody down. And Stephanie, honestly, I was a little nervous that I might have made your box too heavy because I wasn't sure if you had a walk up or not. And I didn't know how your packages get to you, but I'm glad you.
Yeah, I'm on the 4th floor walk up. I left the package downstairs in the lobby until it arrived on a dialysis day. So I took it with me straight to dialysis.
Oh, perfect.
But it might be easier if the box is heavy, I can give you the clinic address and you can send it to me there directly.
Yeah, well, yeah, Stephanie, please email me.
I'll email you
The clinic address.
Okay.
Yeah.
Okay. Thank you.
Okay, so far I've got Anel would like a box. Let me see who else here in the chat. We've got it's great. We've had so many people talking in the chat that there's lots of comments. I just want to make sure I don't miss anything. Let me make the chat window bigger here. Charles Rice, hold on. Oh, so we're still recording. So I'll just go ahead and stop the recording. So this part doesn't have to be on for everyone else to see, but want to thank everyone for joining us and for watching on YouTube. And we'll have a fun dietitian-based session to end the year in December. So thanks again, everyone, for joining us.